this weekend. I want to say a few things. I want to thank you all for coming and making this possible. And I hope we get a good exchange of information so everyone can go back home and utilize it for the suffering mankind. We made out in the little brochure that dentistry can be both life-enhancing and death-promoting. What we wanted to do is enhance life. Ideally, that's probably not possible doing dentistry where you operate on teeth and put foreign substances in the teeth and jaws. But I think prevention is the answer, but it doesn't appear that prevention is going to happen in this century or even the next. We still have to play the dental industry game. Hopefully this will lay the groundwork and offer the proofs. Biological dentistry will offer the proofs that the absolute necessity to prevent dentistry as we know it. We have today a number of speakers, the first of which is Mr. Burton Goldberg, who's the publisher of that tome that you've all seen around, Alternative Medicine. It has a subtitle.
The Definitive Guide.
The Definitive Guide, there it is, from the Definitive publisher. Burton, if you'd like to come on up and we can get started here. We did start on time, didn't we? Or close to it,
Yeah.
within a few seconds.
4 minutes off.
4 minutes off. Thank you, Burton.
Good day. It's an honor to be here with you courageous guys. You are truly courageous and beyond and above. To practice the medicine that you practice in the climate that you practice in means that you guys are above and beyond the call of duty. And you pioneers will be recognized someday and real soon. The reason I did the book Alternative Medicine, The Definitive Guide, was to tell the public that most medicine is medieval and evil and harmful, and that the reason we have degenerative disease is because of the toxins that are coming in from our water, air, and food. Alternative medicine is multifactorial, and it's very difficult for people to understand that. If it was so good, why isn't my doctor using it? In February of this year, 94, I got a call from a young gal by the name of Stacy Milgram, a 34-year-old mother of a 4-year-old kid. 3 oncologists in Boston told her to remove her left breast because it metastasized into her lymph system. And what should she do? She read the book, and a close friend of mine sent her to me. And I recommended a doctor in Virginia, who's here with you. And so her mother called down to Virginia, and she said, "What about this guy, Vincent Speckhart?" And the guy said, "Stay away from him, he is a quack." Stacy wanted to keep her breast. She had read the book and she had faith, and she went down there. And in September she called to say her cancer's gone. Within a month and a half, her left arm pain disappeared. She regained her energy. She started eating and simulating. Now, what did this quack do that the clowns weren't doing? The oncologists of America, who have known the reason for cancer since 1968 and have said nothing about it. He took away the poisons, the pesticides, the herbicides. This quack said that 86% of his 1,000 patients had an involvement with DDT. Can you imagine that? And what did he use? I think her whole cost was $4,000. She'd come down with 5 trips and bought medicines and so forth. And he taught her how to eat. He gave her a book on diet. He paid attention to her dentistry. Now, in the past, I've worked with Doug Lieber and watched him, studied with him for a couple of years. I have seen him take chronic fatigue patients and tell them, Don't do anything. Just get the infections under the gum, the cavitations taken care of, and then we'll talk. So this young gal in Aspen where I live, she'd been chronically ill for 22 years, difficult to get her head off the pillow. She went to the dentist, and the dentist said, there's nothing here, nothing in the x-ray. Brought in the surgeon from Grand Junction. He said, Bill, I'm not going to open this up. It's ridiculous. There's nothing here. He said, well, let's see what these guys, she's my girlfriend. Open one. Half the size of your pinky was an infection. All three were infected. Cleaned out all three cavitations, and within 60, 90 days, she was like 95% better with nothing else. I've seen Doug tell patients to go and have this tooth removed, and it would help their prostate cancer in excruciating pain. This was in Arizona. Doctor pulled the tooth, instantaneously the pain disappeared. I've seen people with lymphoma and going through IVs and all kinds of alternative stuff. Finally, when Issels came out to Arizona and said, do this, this, this in the mouth, she had her dental work done, and then within days, her lymphomas start melting. This is a new form of medicine, and it's very difficult to get this story across. It's almost unbelievable. In our book, we have a chapter on biologic dentistry, and we tell it very simply to the public. The book is made for the public, but all the doctors will learn from it because everything in the book is said by a doctor. The 380 of the world's leading, giving, caring physicians who tell us how to handle any of the 208 health conditions. And I do a lot of work now on radio and television, telling the people that they're getting silently poisoned to death. What else? I think that's basically the story. Thank you for letting me address you. Yes, sir.
You were going to mention the work of Vincent.
I just did. The work of Vincent Speckhard. I mentioned Dr. Speckhard and how this young gal went there and had her cancer reversed in a short time. And what he did is he used, you're right, what did Dr. Speckhard do besides the diet and the dental? He used homeopathics to pull out the poisons. Why did he know the poisons were in the body? Because he used a computron, or one of those electronic devices. The computron has a computer. He was able to find out what poisons were in her body and where they were. And he used herbals, and he also produced his homeopathics in the well, in the device, specifically for that particular patient. And he pulled out the poisons, and this gal is free of cancer and is living a totally different life now. Yes, sir. Sir?
He uses the miasms.
Oh, yeah, right. I hired a young man who is a cancer survivor. His name is Neil Dublinsky. There's a whole page on him. And Neil had lymphoma. He had gone to chemotherapy, radiation, and when all that failed, he went to bone marrow transplant, very painful, expensive, excruciating, and ended up no good. They declared him finished. He was 27 years old. Went down to Brzezinski, and Brzezinski gave him his anti-neoplastins, but Brzezinski is not holistic. So he continued to read, and he did his dentistry, and he did his mental, and he did his diet, and he did the colonics, and he cleaned himself up, got rid of the parasites. Did this all on his own because Brzezinski only knows one thing. Brzezinski's kind of a Johnny One Note, but a great one. There's nothing wrong with one notes as long as you know that you need the other notes to make it all happen. You need a whole chord. He's now over 5 years, and he's well. He's doing incredibly well. So he was interviewing Dr. Speckhard for my book. And incidentally, I could not use Dr. Speckhard's name in the book because he was being subject to his license removal in Virginia. He retained his license after spending hundreds of thousands of dollars. and anguish. You know how they control. They control through the license, and they make examples of one here and there. But his patients threatened the board in Virginia that if they removed his license and the loved one died, they were going to come after their ass personally. And it worked. He retained his license. And so now he goes through a dance between one office and another with declarations that you know what you're doing is experimental and so forth and so on. He interviewed him and we had a transcribe, and I was reading it one night and it went like this. What kind of cancer did you have, Neil? And he said, I had lymphoma. And Dr. Speckhart said, that's usually a tuberculosis miasm. Now, I had gone to Germany and learned some stuff, and I heard about miasm, and I always thought that it had to do with depression, and that syphilis miasm was inherited down the line, and it had to do with depression. And I heard that so many people with cancer had inherited markers, the elusive oncogene. Speckhart said it's usually a tuberculosis miasm. I bet you it started in the tummy. And the kid said, yeah. And I had an explosion in my head. I had never related the oncogene or the miasm that they knew about 200 years ago to cancer. It's also in AIDS. There's, amongst all AIDS patients have 3 to 5 miasms. Is that right, Doug?
It's a combination, yeah.
Combination. So, it is imperative for you to understand that the EAV, the electric acupuncture by Vol, whether you use a Computron or another device, is extremely effective in seeing disease before it manifests, along with microscopy, the dark field, the Gaston nascens. There's many roads to Rome, but by using them jointly and by using homeopathics and herbals, we're having incredible results with cancer. There are very few doctors who understand this, and it's understandable. In this location will be a clinic that I am helping Mary and John Herrick. I'm giving them my advice, and physicians who can be helpful in teaching other physicians. It will be a clinic to do degenerative disease, including cancer and silicosis, the breast implant scandal. And they're going to open this clinic as soon as possible, and some of the most incredible physicians in this country, William Lee Cowden, who just closed his practice in Dallas to come here and to instruct other doctors and to treat people. And there's a need for this kind of clinic. There's a lot of clinics around, and everybody has a piece of the pie in a puzzle. It's like the blind man and the elephant. And most physicians, after a while, are great teachers, but they forget to be students. And the physicians that will be coming here are all going to be teachers and students, because we've got a lot to learn. And it's amazing. I had a conference about 2 years ago in my house, and we had Charles Farr there, our hydrogen peroxide genius, and we had Dr. Speckhart and Lee Cowden, and they're all in the room right now, and it's pretty amazing. These guys are on the edge of the envelope, and you got to listen to them because you learn things that don't exist. And then I just met for the first time yesterday Dr. Scheidel, who I had breakfast with, and he blew me away of the information he has on vaccines and what's going on in Germany that's little known, the use of bee venom. There's just so much here. God bless you all.
Are there any questions at this time? Okay. Okay, thank you. Let's see. Now, our next speaker is Dr. Andy Landerman. We can have some questions and answers if you have anything that you wanted to ask Mr. Goldberg now. Okay, Dr. Landerman, do this thing. Dr. Landerman is a graduate of the University of California, School of Dentistry, 1967. He worked for 8 years as director of a dental clinic, communal dental clinic in Alviso. He's been in private practice since 75 to 87, then from 91 to 92, and went to acupuncture school and did 2 years there and naturopathic certification in 1993. He's trained with Dr. Vole, Thompson, Dr. Morel, Hermann Duque, as well as Peter Dosch and many other German physicians and dentists. He also gives mention here to his teachers being Doug Cook, Tom Stone, Lovell Ferris, Tim Guilford, Gary Olin, and Dr. Linda Wright. I'm glad he brought that up because we teach each other and we have a lot of information to exchange. And if you don't know something, you're supposed to listen. I think you should maybe form a question before you listen. So Andy, if you'd like to come on up and get started. And there's no hurry in this thing. We have all day to do what we're going to do. So let's put this on you and get started. You can just put it in your pocket.
Good morning. Welcome all to Puerto Vallarta. I think this is a good example of we're finally coming of age in the sense that normally when I think of alternative practitioners giving or having a conference, it's usually a suffrage kind of ordeal. We go to the worst hole in the universe, usually the middle of the desert or the top of a mountain or something like that, because we can't give to ourselves. But I think that this is an example that we're finally learning one of the secrets of life, that we can be happy and make others happy and well as well. So welcome, have a good time. You know, one of my most meaningful experiences, albeit, well, actually one of the more fun experiences, has been the last 7 or 8 years farming. And meaningful in the sense that it put perspective to my life. And you know, I practiced for a while in dentistry and then had the fortune of having a long vacation where I could ride a tractor and be out in the sunshine and watch a lot of good things happen. Got a chance to forget all of the troubles that were going on around me and just observe. But you know, when you're out there trying to be a professional at whatever you're doing, you realize that you're being judged by your peers. My peers were farmers, had to accept that judgment. So I said, well, okay, how does a farmer judge a farmer? Well, they don't judge you by the food you grow, how good it tastes, how it looks, etc., because they don't ever buy your food. They either raise it themselves or go elsewhere. They're too proud for that. Well, what else do they judge you by? Well, by the straightness of your row is one criteria. And as I'm sitting there on the tractor, endeavoring to live up to their yardstick, I look behind me and, damn, that's not straight. And as I'm going along and trying like hell to make that thing straight. Every little clod in my way seems to influence the steering mechanism of this behemoth beneath me, and anything I do seems to aggravate the situation. And every time I look back, I see another crook where I looked back before. And I determined myself more to maintain that straight and narrow. And I sit there and I grit my teeth. You know how they talk about farmers have hard dentition and so forth? Well, I found out why. Knocked all my teeth out, you know, doing that. But anyway, I'd get to the end of the road and I'd look back, and every place I looked back, there was a crook in the road. I did this for 2 or 3 years, you know, all day long, every day. finally, one day I was kind of daydreaming and got to the end of the row, and geez, you know, here I am. I almost ran over the fence and into the canal. Turned around, start to go down the next row. My God, that row was straight. What happened? Well, one of the Buddhist things of life is, if you try to be what you want to be, you'll never be what you want to be. So if you just be, you'll be what you want to be. And so I kind of analyzed what I was doing on that last row. I was just stargazing off there at that tree on the horizon. It was a beautiful tree. And lo and behold, I got a straight row out of it. Well, it was a kind of a lesson in life, and one that many of us learn, I guess, some early, me always later. But if you kind of set your world up around you and let it happen, it's going to happen. So I said, well, what is it I want to do? Well, I think I'd like to go back into dentistry, go back into dealing with people again. I think I've sat out here alone long enough. Drank enough beers, got fat enough, that kind of stuff. And so I think I'll make life work for me. And life works for you if you let it. And I decided to begin to let it help me along. So I just decided that I'd like to be in some sort of a situation down in Puerto Vallarta. Looked like a nice place, never been there, heard a lot about it. So lo and behold, about 3 months later, John called me up. Never met him before that I knew of. He reminded me of a situation where I met him about 10 years earlier. And so we ended up down here last February. Been working together ever since, trying to get this thing going. So once again, I have to welcome you into our house, soon to be, hopefully. We're slated to begin in late January, early February, beginning to set up a clinic the likes of which nobody's seen before, that will incorporate all of us in a teaching institution, in a learning institution, and one that we hope will be a landmark for time to come in terms of putting together projects, research type projects for everybody to benefit from. So once again, welcome. I was given the dubious job of dealing with the topic of death in dentistry, and I was told to be pleasant. I'm not sure quite how to accomplish that, but we'll try. When I learned all of this EAB stuff, I got kind of intrigued by it, but I couldn't put any perspective on it because I was so new in it and so immersed, being a dentist and feeling somewhat guilty about all of the sins that I had committed on all of these people. I was committed to right the wrongs of the past, and so went into it with fervor, and you know what that gets you. Well, anyway, time gives perspective, and with perspective, I began to think about what is it that is really affecting people when we're doing dentistry, and we had to come down to, or I had to come down to the fact that I had to go to the basics of energy. I had to define the science in which I was existing. If we look at mankind, we try to define mankind in terms of his accomplishments or her accomplishments. And we look at Da Vinci and all that he accomplished. We look at Michelangelo and all that he accomplished. And we look at Edwin Moses, Ty Cobb, et cetera, et cetera. And these are how we define human accomplishments, human potential. But we also have to look at the other side of it. How do we define human pathology? And the ancients in my science, in our science, well, the most recent one, of course, is Hahnemann. And he came up with, of course, the yardstick that Burton Goldberg mentioned, and that is the miasms. And I think that that's a good place to start. If we look at miasms for what they are, some call them trash genes, oncogenes, whatever you want to brand them. But if we define it further, we have to recognize that they are things in our makeup that we cannot alter by ourselves. We can't alter them with nutrition. We cannot alter them with exercise. We can't alter them with mental exercise. These are influences that come from elsewhere that are with us to stay unless we try to understand them and get to the bottom of them. So the basic four, there are more. Obviously, there's still more to be defined, but the basic four are, of course, psora, the psychotic miasm, the lytic miasm, and the tubercular miasm. Do we have some water? Thanks. Well, just wanted to mention, the reason that I mentioned these folks at Doug Cook and Lavelle and Gary, et cetera, is because I sat in them with through many seminars which I gave, and I think that in reflecting, they probably taught me more than I taught them. I'm not sure what that says about my teaching, but I want to thank them all for their benefits. But as we look at the miasms, we can put them into the various categories of the Western fire, water, earth, and pardon me, and air. And we always have a tendency to want to categorize things. So we'd have to give that to the fire element, and the psychotic miasm more to the water element, and the lytic to the earth element, and tubercular to the air element. And we'll see if we can explain why. This is not in text, so this is kind of a definition that will be hard to define, but we'll try to get there. Now, if we look at psora, refer to some notes here. Getting old, I guess my glasses are getting messed up on me here. Psora is a miasm that is little understood, I think, because of its pervasive or its general occurrence in society. I think we all have an element of psora in us, but it can be said about psora that if that was the only miasm we had, we would probably live forever, because in psora there's no pathology. Psora is one that is all symptom, all bark and no bite. It's the proverbial hypochondriac, the one that goes to Doc's office and Doc says, I hear you crying, but I can't find anything. Did you have a question? I'm sorry. It's one whose carrier is very reactive for all the right reasons, but doesn't show any consequences of the insult to which they are supposedly reacting to. A psoric person doesn't ever show the pathology that can be proven in a proverbial medical court. So we tend to look at these people in a rather discerning way, but they're the ones that tend to go on. They have very strong egos. They tend to be high achievers, but they always have a sense of doubt about themselves, not knowing if they can accomplish anything. Even in disease, they don't know if they're going to come out of it, but they always do. And they have an inner sense of this, but they also have an inner sense of doubt. Now, second in the list of miasms is probably one of the two most important as far as dentists go, and that is the psychotic. First of all, we have to understand that the psychotic does not mean psychotic as in psychosis, but psychotic in a Greek sense meaning fig. Fig defines the symbol for which psychosis was, or psychotic miasm was named, in that it's named for the figwort, and hence the name. But psychotic miasm is one that we have to deal with most often in the Western society because it deals with repression. It deals with inflammation, suppression of disease, suppression of infection, suppression of emotions. So in that, we find pretty much all that we do to people as physicians, dentists, therapists of any kind. We do our best to suppress that with which they come to us. In that, if somebody comes with an infection, what do? Antibiotics. If they come with emotional distress, many times we placate them, but by and large it gets repressed. If they come with a bad tooth, a dead tooth, what do? Again, antibiotics, root canals, we repress it. As we all know, these things get shoved deeper into the body. And what happens? Emotionally, these people are somewhat disturbed. Psychotic miasm represents, in the disease state, in the epitome of psychosis or psychotic miasm is a gonorrheal miasm. But that's not the only way we acquire it. In gonorrhea, what is the hallmark of gonorrhea is pus production. So we look at a gonorrheal person, we see usually a condition that continually produces pus. Whatever it is, they'll produce pus. And they produce it and feel better by it. It doesn't necessarily have to be pus, but as we say, it's a water sign, so blood, water, urine, pus, whatever it is that's pathologic, they feel better when they're releasing it. Just as many people that you and I have extracted teeth on, they feel better when the tooth is out. That's because we have repressed it for so long, it feels good to get rid of it. Now, if we go on to look at the psychological aspects of psychotic miasm, we find that these repressions cause many of the psychological ills that we see in our society today. Repression causes distorted behavior patterns. It's even given to criminal behavior patterns as far as the psychosis or psychotic miasm goes. If we, in fact, there are many say that the criminal mind is the psychotic mind. That's really hard to substantiate, but that's an aside. one of the true natures of a psychotic miasm or psychotic person is one who delves in the secret world. Because in fact, if you look at the disease process itself, you don't have any problem telling somebody, "Oh, I got the flu," but you're a little bit apprehensive to say, "Oh, I got the clap." So therein is kind of the signature of that disease. And so that you see that these people tend to be very secretive in nature in terms of their patterns and what they do. They tend to be hiding things all the time from others, not necessarily that they're bad things, but they just don't want to be observed. This is the nature of the psychotic miasm. And as the prime remedy that Hahnemann came up with for this was Thuya. Thuya is, anybody know what Thuya is? Pardon me? I'm sorry? Yes, what kind of plant? Cedar. It's a white cedar. And I didn't really observe cedar trees for what they are until I was back at Doug Cook's one week hunting in the fall. We were hunting partridge, and he kind of said, "Well, you go over there, and you go over there," and so forth. And he put me right in the middle of this cedar grove. Well, I learned that cedars represent death, dying, and destruction. I mean, everywhere around me was dead trees, moss, anything but partridge. And my good friend, put me right where the birds were, But the cedar throughout the world has been known to be a tree that dries up swamps, dries up wet conditions. So likewise in the body, that's what it's used for, to dry up the psychotic miasm, which is the wet condition. It accomplishes this by sucking out and excreting these poisons that are within the body. Some of the other psychotic remedies would be lachesis, which is, once again, the hallmark of lachesis is that the patients feel better when they're bleeding, when they're giving off pus, etc. Staph agria, another very powerful psychotic remedy, in that it is used to correct sexual assault on the body in whichever way it comes or has come. Sexual diseases, things of that sort. So with each miasm, of course, Hahnemann has remedies, others have remedies that work quite well in their amelioration. The next most important remedy to dentists, as far as miasm go, is the syphilitic miasm, lytic miasm. Lytic miasm is represented, it's the earth element. And as we look at that, we have to begin to understand that what these earth elements do in the body. What do they create? When an aberrant earth element is in the body, what does it create? It creates aberrations in the vascular system, creates problems with the mind, creates problems with the bones. In short, it's totally destructive of the living creature on a long-term basis. Anger, fits, depression, pretty picture. But we've all seen it in textbooks with syphilis and so forth, yaws. These are things that we've all read about, but we don't think much about it in our day-to-day work. The fourth miasm was not really a miasm in Hahnemann's time. Actually, waited until after he died to define it. But I think appropriately it deserves its place there because of what it creates, and that's the tubercular miasm. Tubercular miasm is more of a it's a miasm described by flight, by air, by lightness, by slender personalities or slender persons, airy, I won't say airy fairies, but California flakes, those kinds of things, you know. The hallmark of the tubercular person is one who's lived through a life-threatening disease and wants to get the most out of life as short as possible. Maybe wants to put 80 years into 20 years or something like that. We all have that element in us. We all have a part of tubercular miasm, as we all do probably other miasms as well. But the tubercular miasm is probably the most noteworthy in terms of modern day life, because if we look at what happens in tubercular miasms, they don't, these people have disease and they don't fully recover. A psoriatic miasm, a person has a disease and they'll recover. They'll have a disease, they'll recover, etc. But a tubercular miasm, they have a disease and they don't recover. They just get worse and worse and worse and just slide downhill. So it's kind of like living with the sword of Damocles over you, knowing that the first rope has been cut. When's the second one going to be cut? And so they live their life. Now, I'm not going to go into the other miasmic forms of carcinomenum, etc. Some give influenza that position as well, but because I think that the ones that most concern us in the world of dentistry are the four that we mentioned, particularly the psychotic and the luidic. Now, why is that so? Can anybody give me a plausible answer? Well, as we said in the psychotic miasm, everything that we do in dentistry that is of a curative nature is to suppress the individual response. We're trying to suppress the inflammatory response. We don't allow things to come out. Specifically, root canals, restorations, infections in general, and hence we see the product of that. Now, one of the things that early became obvious to me was that when I began doing EAB and dentistry associated with EAB, was that there were certain cancers associated with phenomenon in the mouth. And I think the most remarkable one and the most consistent one was non-vital teeth with respect to breast cancer. And I thought it was 100% with respect to number 3 and number 14, with some variations on number 2 and 15. But I saw one woman about a year ago that had a scar across her stomach meridian. She didn't have any dead teeth in her mouth, but she did have the scar across the stomach meridian, which took the place of a dead tooth. So I think in probably somewhere over 50 cases of breast cancer that I've seen, that's been a very consistent feature. Only one out of those did not have a dead tooth. Now it's hard to say which came first, the chicken or the egg, but in terms of the histories that I could ascertain, the vast majority of times the tooth was non-vital before the breast cancer manifested. Now, if we go back a step and look at miasms with respect to cancer, and we see that one of them, a consistent finding in cancer is the psychotic miasm, as well as the tubercular, as Burton so aptly points out. So that what are we doing in dentistry? We're creating, when we perform these acts on people, a death act. Now, the solution is not always just to extract the tooth, of course, because the process has already started. At that point, there may be luck on the side of the patient, there may be not. There may be a lot of other therapies that need to be done, but that certainly is the first and foremost thing that has to be performed, is to remove the offending object from the body. The pardon me. The other consistent finding is in the area of the ovaries, prostate, etc., is in the anterior teeth. That again is almost as consistent as the upper first and second molars on breast cancer. Now I was sitting talking with Tim Guilford last night, and we were talking about ENT. He's an ENT specialist, and we talked about surgeries, etc. He said that he doesn't do surgeries anymore. Hasn't done them for how long, Tim?
Probably 3 years.
And yet he still performs his duties as a specialist. He said that he just doesn't need to. There's no reason to do surgeries. Well, he can recognize that the things that cause the need for surgeries are generally in the mouth. And we discussed it further, and I said, well, we talked about polyps, etc. And he said, well, you know, if I get something I don't feel good about, I just send it to somebody else. But I said, well, you know, the point is that you know, most of the time you extract the tooth. And he said, yes, but when you do that, you do everything else too. And I had to take a step back and realize that yes, there is a lot of prophylactic work that goes along with dealing with these problems, so that it's not something that you can just step into and say, oh, there's a root canal, we'll just take it out and get rid of that polyp or get rid of that infection and so forth. You've got to take care of the wake from the boat. You got the boat out of the water, now you got to take care of the things that are happening behind it. And that's not easily done, and it usually requires a team of people to do it. That's why John and Mary decided to open up this center, to gather around them as many people with as many skills as possible to do these various chores. Now the other important miasm that we need to talk about is the luidic one. The reason being, of course, it's the earth element. And what is in the earth? The earth is comprised of metals, heavy metals, specifically to us. And in that's the majority of the work that we do. We place heavy metals in the mouth. From gold, silver, mercury, all the way down to titanium, which is supposed to be inert, inactive, etc. These things, when placed in the mouth, create the syphilitic miasm. There's no mistaking that. And if you have a syphilitic miasm, a strong syphilitic miasm to begin with, they accentuate it. So if you look at what a syphilitic miasm is, what it does to the body, then look at what we're doing to the body and see how it responds. It all makes sense. What does syphilis do? Syphilis creates bone cavities, creates depression, creates circulatory problems, creates all kinds of nervous disorders. What do we see in patients? We see a lot of cavitations. We see a lot of depression. We see a lot of nervous disorders. We see a lot of circulatory problems, hardening of the arteries, typical syphilitic miasm, typical. Sclerosis of any kind is a syphilitic miasm. So what are we doing to patients when we place these substances within their bodies? I don't see any other conclusion that we can come to other than the fact we're killing them with our products. And we're even getting paid for it. Thank you. Yes.
Do you imply then that somebody who's predominantly a non-syphilitic pipe, not a fluidic pipe. It's in some sense safer to use gold.
No, I don't advocate metals at all anywhere in the body. The problem if they don't have a syphilitic miasm, they soon will. In other words, it's analogous to giving somebody that doesn't have a psychotic miasm antibiotics for an infection. You're suppressing it, or giving them birth control pills, etc. You're suppressing a bodily function. In the case of Lewitic, you're creating a situation that they don't already have. Yes, Doug?
Don't you think he's looking or asking for what material is the best or seems to be the best at the time to use to refill the tooth or restore the tooth? That's what I got from this question.
Okay.
You know, what are you going to put back in there?
Rephrasing the question, what are we going to do about a tooth that needs something that we would conventionally think of as gold? Well, I think that we have to first of all perceive dentistry as something other than what it is, what it has been. We have to look at it as being a health science and not a death science. And so in doing that, we have to recognize that we don't have all the answers yet in terms of materials. We have to compromise in terms of the materials that we've been using, and so that the materials that are available that tend to be acceptable, given the person, given the patient, are the plastics and the porcelains. I don't think metals are any longer acceptable. We know too much, and we cannot turn our back on what we know. Yes, sir.
Dr. Landerman, would it not be well here to make a distinction between dissociable and non-dissociable metals? You cannot get a composite that does not have aluminum in it. But if it is bound with silicon as an aluminosilicate, as a quartz, as a mica, as a feldspar, we really don't worry about it because it doesn't dissociate versus those metals which can come apart. I think the issue is not absolute content, but rather dissociability.
Well, I think that you're a renowned chemist, and and I can't deal in that world, but I have to make the distinction between chemistry and energy. And energy is something that you can measure, that you can determine in the realm far beyond the realm of chemistry. If you're measuring energetically, then in dilutions far beyond the realm of physical chemistry, you have measurements, you have energetic phenomena occurring. And these are the things that the body responds to. It doesn't respond necessarily to chemistry, although chemistry can create pathology. But energy creates pathology far more deeply than chemistry does. As if we didn't have these machines that could determine these things, I wouldn't know a damn thing about what I'm talking about. But having done it for 20 years, it's become obvious to me that chemistry is no longer sufficient for us to define things. It's not a yardstick for us any longer, because the body works on an energetic basis, not on a chemical basis. Chemistry only masks symptoms, just like drugs. Drugs are chemicals. But we can use homeopathic remedies in the realm of dilutions of 200x, 1m, 10m, etc. This is not a chemical reaction. Now, if you're putting gold into the mouth, no matter if it's dissolving or not, or aluminum, look at the problems that aluminum causes, or that aluminum will cure in the homeopathic sense of 200x. You look at that, and you'll find that these are phenomena we have to acknowledge. And certainly these are not things that we can turn into our traditional brothers and say, well, look at aluminum, look at the homeopathic effects of aluminum, so therefore we can't use aluminum. They're not going to listen to that, but we have to listen to that because we know better. And whether it's bound up as aluminum salicylate or whatever other compound might be devised by man, it's not man that's determining, it's somebody higher. Burton?
In Germany, they're using glass that's highly fired and then inserting it in the tooth. What about that?
Well, glass I think that there are other people that could define glass better than I in terms of its contents. But Clifford, what?
It's an aluminosilicate.
Right. But some of the glasses have less aluminum than others. Yes, sir. Burton?
No, I just.
Okay. And what I found is that the lower the aluminum content, the more that it's tolerated. In other words, the higher numbers of people can tolerate these things. The other factor is that the glasses are amorphous. They're not crystalline in structure, which makes a difference. And plastics are amorphous as well, whereas your metals are all crystalline. And the body has its own crystalline structures it can relate to, and it does not incorporate metals. Yes?
One other thing that becoming aware of, and another possible problem with metals that we didn't have 50 or 100 years ago, is that they are an antenna for electromagnetic frequency vibrations. And we have an explosion of electromagnetic pollution, we might say, from satellite and radar and all these broadcasts and cellular telephones, and everything is filling this broadcast spectrum that didn't exist at all 100 years ago before radio. And even just in the last few years, this is coming into place. I think any metal that's in the body is going to be a stronger antenna to pick those up and put in frequencies that may be disruptive, other than just the problem of the chemical or the other problems of the metal itself. It's our environment in today's world.
Yes, that's very true. And we only have to look at the people that make claims that nobody wants to listen to, that they can get their favorite radio station on their teeth.
A point to verify what Doug says, I was on the telephone to Robert O'Becker, and I said, what about this idea that the metals in the teeth act as an antenna? And he says, I can't talk to you over this telephone about that. So, somebody's looking at it, okay?
Any other questions? Okay, I think.
Those of you that are wondering where Dr. Ole Reddy is, he's at home in Sweden recovering. Stuart Spacekel gave me a book that he had written called, in Swedish of course, called Sick from Amalgam. And it was a beautifully illustrated book with a lot of color photographs and all. And now this doctor, he's become very ill. He's had an attack of shingles, and he had a toxic thyroid removed, toxic with metals. I don't believe that he used any protection for himself or the patient when he did these things, but he had about 100 cases in the book, dental resolutions of the autoimmune diseases, ALS, MS, and Parkinson's. So he wants to come, and he'll come probably next year. But I think you should write a sequel to the book, Sick from Amalgam, and call it Sick from Removing Amalgam. Dentists have to know and remember that this stuff is not healthy. And they're in a combat zone. They should get hazard pay. Protect yourself. We didn't bring a lot of respirators and stuff, but people that are in the field removing these things should protect the patient and themselves. Not only covered with antioxidants and vitamin C and a whole array of other things that we use, but they should use a rubber dam and isolate the teeth that they're treating and removing the stuff. And like I said at the beginning, I think that as we do this non-metal dentistry in a big way, we'll see that it's never going to ever be perfect. And I think that our ideal goal should be perfection. In other words, we've been admonished by the Bible to be perfect as our Father is perfect. And that's a hard thing, especially when you have a lot of holes in hard structures. And it all starts with in the intestine with various kinds of imbalancing, dysbiosis, reflected in the teeth being demineralized. And we want to live up to this we should really start to look at that. And any questions on what I just mentioned? I can field questions better than I can just extemporaneously start talking about things because I don't know where to stop. Lee?
You know, Becker used electromagnetic fields to heal fractured bones. Has anybody looked at using electromagnetic fields to fill in small cavities in teeth?
I don't myself think that that's possible. I think that you can use electromagnetic fields, electricity basically, anode, cathode kind of things to drive the metals out of the body with the help of various kinds of selenium compounds or homeopathic preparations that they sell in Germany, or the work we're doing now with Dr. Dietrich Klinghardt. He has a, this last spring he taught a course on neural therapy without needles. And I'll tell you how this started. I went down to his office, about 4 years ago, and he was treating patients, and I was looking at his bookshelf, which is in the center of his treatment rooms. And I picked this thing off the shelf, and it was a book by Dr. Yanker, who's a physician in southern Germany, and a book on the electrical control of pain. So I asked him if I could take it home and read it over. He said, sure. I don't think he hadn't looked at it. And I read it, and I says, brought it back to him a few months later, and I says, Dietrich, I said, we got to look at this. This is important. So the next thing I know, he read it, and they made a syllabus, he and Louisa Williams, and then he has down in there the whole neural therapy treatment, the cleaning of the ganglia using Dimavol and DMSO without injecting it, using electricity to drive the medication through the tissues and through the ganglia, clean it out, and which is a really a good thing, because that now means that chiropractors can do it, possibly dentists can do it. People that are concerned about dentists doing things, when Van de Kamp, I think, was the Attorney General of the state of California, he wrote a paper, a position paper on what a dentist can do that was called into question. What was his particular spectrum in medicine? And basically he could do everything that the physician could do except palpate the liver, and there was two other things about it as innocuous as that, but basically the dentist can do everything. I don't know who's controlling the dental board, but I think they're totally misdirected, and I may get a chance to tell them that. I'm going to mention to you what happened. I had a patient come in and did an examination for her, and I wrote up a treatment plan, exactly what we were going to do for each tooth and how much it would cost, so that she could have an idea of what to plan on. Well, I hadn't heard from her for 3 or 4 months, and then I was out of town, and somebody came, we got a letter from her that the dental board had sent to her soliciting her complaint. Okay? She had gone to another dentist on an emergency basis, and evidently she showed him the treatment plan. So whatever the treatment plan may be, all being non-metal dentistry upset him, I don't know what, or maybe the 2 root canals being extracted might have upset him. But nevertheless, they subpoenaed this, they're in the process of subpoenaing this record from me, which I have to deliver to them on the 6th of December. And I don't know which way I'm going to go. Let's have a show of hands. Give them the record or not give them the record. First of all, give them the record.
What does the patient want?
Well, it says 54-40 or fight, okay? I think that's what it is now. So don't give it to them. I have a tendency to do that.
Could I ask one question?
Sure.
Have you performed any procedures whatsoever on this patient other than the exam and the estimate?
Nothing. I have done nothing.
And
I only saw her that one time. Pardon me?
I wouldn't get many.
Okay.
Well, the patient's inclined to do that, but I haven't been able to confirm that with her yet.
What does the patient want? Have you had a conversation with the patient?
No, she has multiple problems, environmentally ill. And she just, I don't know, maybe she's out saving her money. I don't know. So, Lee?
I have a suggestion to try to avoid that kind of dilemma in the future. If you'll have every patient that comes into your office sign a form that says, I do not wish my records to be released to any entity, governmental agency, medical board, dental board, or other, without my express written permission. Okay?
Mhm.
If you do that, it's much more difficult for those entities to get those records.
Do you have an attorney that you've checked with on this?
Oh yeah, I have two attorneys, both with differing opinions. So I'm thinking, well, that's what I like. Now I want to know what the options are here.
Who are those attorneys?
Well, I haven't retained them, so I haven't given them any money.
There's
So
a guy by
I
the
just
name-
phoned him and asked him for advice.
There's an attorney by the name of Jaffe in Houston that represents.
That's Richard Jaffe.
Yeah. And I would use him as an arbitrator in between the other two.
Charlie?
The standing for what you're requesting, he just got through mentioning, if you get the patient to sign the document that says that under no circumstances I will find records released, the standing is the Fifth Amendment of the Constitution, that your liberties is defined in there very clearly. And any attorney can read that, and that patient has a right to withhold their records as privacy against anyone. If you have that document signed ahead of time, then no judge in the world can make you give up those records because they're forcing you to break the law. That becomes a contract with the patient. They force you to breach contract.
Well, this subpoena that I had,
Make it down.
it was intimidating, you know.
Yeah. Subpoenas don't mean
But
nothing
Landy?
these days.
I get a lot of free advice now. It's great.
I might point out that a good friend of mine had the FDB, the state of California, equivalent of FDA, come into his office, take a dermatron and a laser, and they did this illegally because they had no search warrant, but they were able to actually talk him out of it. And he not giving it to them, they had no right to it. And you're in the same predicament. If you give it to them, they can talk you out of it, it's theirs. So don't do it.
I agree with you, Andy. I'm not going to give it to him.
Also in the U.S. Criminal Code, there's laws that have been acted into to our benefit that say that if the governmental agent comes into your office and intimidates you, that you can bring action against them as an individual for anywhere from $10,000 to $100,000 and possible loss of job.
Right. Okay, well, it's getting to be close to break time, so why don't we break till about 10:30, okay? Is that about right? Or 10:45? Let's make it 10:45.